Hi and welcome. I'm trying to learn medicine. Today, Angina Pectoris. And after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And we're talking here about a disease or a medical condition, and it's also a psychological medical condition. And to talk about it can be maybe a bit uncomfortable. So, Angina Pectoris. And this is no medical advice or anything, we're just reading what's there. We're just trying to learn. Angina Pectoris, that are attacks of choking or throttling pain across the upper part of the chest due to reduction of the blood flow through the coronary arteries which supply the heart muscle. And I haven't really thought about when I want to say it, but at some parts I'm maybe going to say that this is not really intended for people who have it or think who have. This is not medical advice, this is just for learning about it. So we're talking a bit little differently about it also. Now, because I want to say it, throttling pain. What is throttling pain? I don't really understand the word throttling. I know it from motorcycles. And I think it's interesting that blood flows can cause throttling pain. Now, pain, why pain if just blood is not coming? So we're talking differently about it than as medical advice. And also the same thing with heart attacks. I don't really understand how heart attacks. I thought it was something way more complicated, but it seems to be just that the myocardium doesn't get blood at the heart. Does that cause the pain? Why does that cause pain? Maybe it has something to do with cramps, but why does the body at all have nerves to feel the pain? Why does blood loss causes pain? Or what if, hereby now, angina pectoris, the pain is caused for something else? So, whatever. I'm just wondering about why blood loss causes pain. So, angina pectoris, can attacks of choking or throttling pain across the upper part of the chest due to reduction of the blood flow through the coronary arteries, which supply the heart muscle? Yes, this is actually the same as heart attack. I think. I'm not completely sure. It occurs in spasm and is usually brought on by exertion and relieved by rest, but this is not a heart attack, as far as I understand it. Aphareuma of the coronary arteries is the most common cause. Aphareuma of the coronary arteries is the most common cause. Other diseases such as anemia may produce the same type of pain. Okay, anemia can do it also. Anemia, we're going to do it at one point, that is too little hemoglobin in the blood. And other diseases can be also. It occurs in spasm and is relieved by exertion, brought on by exertion and relieved by rest. Symptoms. The pain usually begins across the upper part of the front of the chest, and can spread to the jaw and down the left arm, and sometimes the right also. The pain can be described as a tight, heavy, constricting or crushing, and sometimes numbing or burning. It is never throbbing or knife-like. I think that is the difference to a heart attack. But I just think that I don't know it. It is never throbbing or knife-like. It is described as tight, heavy, constricting, crushing, numbing, burning. The pain usually lasts a few minutes and is precipitated by exertion or a meal and passes off at rest by a meal. Okay. Precipitation can cause it, and also eating can cause it. Duration. Once angina develops, the attacks usually recur. With treatment, the frequency of attacks can be reduced and may cease completely. Okay, once a person has angina pectoris, and again, this book is 40 years old, once a person has angina pectoris, I think it's also only called angina. I already confused it a bit. Angina has developed angina. The attacks occur regularly, but there is treatment which makes them hopefully cease completely. Occasionally, despite treatment, attacks become increasingly frequent, so it can then also start, even with treatment. Causes. Exertion, such as walking, especially against the wind or up and incline. So physical exhaustion. Cold weather. Just cold weather, or cold weather having a direct effect onto the upper part of the body or whatever. Emotion, which can be brought on by an argument, shock, violence, or excitement on television. So what I mean is strong emotions. and also heavy meals. Complications. A clot may form and block the coronary artery and cause coronary thrombosis. Why could a clot form? I'm trying to understand it. I'm just a bit overthinking. Why could that make a clot form? Reduction of blood flow through the coronary arteries. I don't really understand why it should cause a coronary thrombosis. Treatment in the home. Sit down and rest. If you're walking in the street, stand still. The pain should be relieved within a few minutes. Reduce emotional stress if possible. Attacks brought on by emotion are sometimes difficult to relieve. Take sedative if one is available. Take sedative if one is available. If not, an alcoholic drink can be useful alternatively. But is a medicamentation a sedative? Do not continue exercise or activity. Angina is not likely to work off without rest. Further activity during an attack may be harmful. So rest, do I say. But again, this is not medical advice. When to consult the doctor. If the pain is not relieved within 10 to 15 minutes, or if you have never had angina before. What the doctor might, and I think also what we maybe should add here, that it's, if it is foaming or knife-like, then it is, I guess, a heart attack, then you should consult the doctor. What the doctor might do. The doctor will need to find out the cause, but there are also more silent heart attacks. What the doctor might do. The doctor will need to find out the cause of the angina and to assert its severity. If it is mild, no treatment will be needed. But if it is serious, then various medical treatments are available. If not responding to medical treatment, the diseased artery can be surgically removed and replaced with a vein graft or opened up by inflating a tiny balloon in the artery. Angioplasty. That means angioplasty is at least 40 years old. Prevention. Avoid conditions which produce the pain, for instance exertion, especially after heavy meals in cold or windy weather. Your doctor may prescribe tablets which you can safely take before exertion to prevent the onset of pain. What are the medication doing? Just curiosity, nothing else. For long-term prevention, do not smoke. Keep your weight down to an ideal level. Increase physical activity, but avoid precipitating an attack of angina by using your tablets if necessary. Physical conditioning by exercise often reduces the severity of angina, but be guided by your doctor. I am just noticing that most of the times, maybe even always, when there is advice with exercises, that we're saying the doctor, they mean the medical doctor, and not a specific doctor for sport or sports things. I'm not completely sure if sport, to the extent of understanding sport, is usually part of a training of doctors. What if that is from time to time maybe a little problem? That the people working together then with people who are not really specialized in sport itself. Yes, the medical things behind it, yes, but not itself sport. And I just noticed that there's always written the doctor, they mean the medical doctor, and I don't think it is part of a regular training to learn about sport and sport medicine and so on. And okay, maybe we're talking just about, not about athletes, but just about normal activities. But I just noticed that I wanted to utter that maybe that is a little problem. I don't want to degrade anyone, but maybe these people have not all received during their training to the perfect amount, wherever that would be, of learning about sports medicine and sport. Because I don't think that is part of the training. Outlook. The outlook for angina sufferers depends on the underlying cause. Even when the coronary arteries are diseased, reduction of weight and stopping smoking may relieve angina completely, and may also improve the conditions of the arteries. That would be interesting how many people without smoking or overweight have angina. Okay, that was angina pectoris, but that's always referred just as angina. Now, that was the medical part. If you want to go to the next part, you can go directly to the next part of medicine. We're going to do now the stretching. If you participate in the stretching, then it's better to Angst. Wir tun Schultercircuits, vorwärts. become big, up and front, down. And the last time. And backwards. And the last time. And now we're breathing in, lifting the shoulders up. And breathe out, let the shoulders fall down. Again, in the shoulders up. And out the shoulders down. Again, in the shoulders up. And out the shoulders down. Again, in the shoulders up. And out the shoulders down. Now we're doing the other back. Breathe in, lift the arms up. And reach with one arm at a time high up. Pretend to take an apple hanging high on an apple branch. Turn it a bit around and deploy it. And the last two. And now the arms at the side, and they're doing a shift up, breathe in. Legs wide apart and breathe out, go over to one side, just to the upper part of the body. Breathing in into the middle. And out over to the other side. Breathing in into the middle. And out again over to one side. Breathing in. And out over to one side. Again in. And out, we're leaning onto our knees. We're doing the buffalo fighting its hangover. So breathe in. And out, we're bringing one shoulder in front. Again, in the shoulder back. And out the shoulder in front. Again, in the shoulder back. And out the first shoulder in front. Breathing in. Out the shoulder in front. Okay. And out and we're hanging down. And breathe in. And out, go over to one leg. Breathe again in. And out over to the other leg. Breathe again in. Out into the middle. Breathe again in. And out again. Slowly the front leg up and making it top and backwards. Shoulder. Now we do the garland pose. The torso pointing to the outside. And we're breathing and lifting the arms up. And we're breathing out, we're coming down and we're placing the elbows against the inside of the knees. And breathe in and straighten up the back. And out and we're coming with the back up. And we get in. And out. Again down into the front pose. Breathe in, straighten up the back. And breathe out again with the back up. Breathe again in. And out again down. Breathe in, straighten up the back. And breathe out, come up in one straight line. Let's do this seahorse pose. Good standing leg, the other leg with the heel on top of the knee of standing leg. Breathe into this only if you can do it. But inject itself, breathe in. And out, and we are sinking down. I'm literally wondering right now about condition training. Does condition training target the lung and the heart? And we change it to make lung and heart better to deliver the whole blood with oxygen, the whole body with oxygen? Or is conditioning targeting on training the muscles so that they can do more things without needing so much oxygen? Or is it, or it goes hand in hand, it doesn't work? But it would be interesting if it doesn't work, because every time the muscles are trained, it causes that the lungs and the heart have to do more. So what is condition training? What exactly is condition training? And are there options to train the specific parts of condition training? We're breathing down and out. In. Out. The last time breathe in. And out the arms down. No, that was the stretching. I thank you very much. And the next time.